Okay, good afternoon, everybody, or good morning or good evening, depending on where you're joining us from. I hope you're all keeping well and staying safe. I'm so glad that so many of you were able to join us live today. My name is Michaela Thompson. I'm the Graduate Enrollment Coordinator for the University of Lethbridge, and joining me today is Dr. Carla Carnigan, the Director of Graduate Programs for the Dillon School of Business. So today we're going to go through a general overview of two of our graduate programs, our Master's and Graduate Certificate in Health Services Management. As we go through that information, feel free to ask any questions in the chat or the Q&A. But any questions we don't address throughout the webinar, we'll have some time at the end to answer. So without further ado, I'm going to turn it over to my colleague.
Thanks very much, Michaela, and thank you everybody for joining us today. As Michaela said, we're going to discuss some features of the program, which hopefully will answer some questions you have. But at the end, we will answer any other questions you would like to bring up. So let's get started. So what we're going to talk about today is a little bit of an overview of the program, some distinctive features, how the courses are structured, what the courses are, so you understand what courses you'd be taking, a little bit of information on our instructors, what skills you will acquire and what you can do when you're done with the degree, a little bit about Calgary and the University of Lethbridge for those of you that aren't familiar with us, details of what you need to apply and admission requirements, some information on fees, and then where you can go for more information. So this program is offered from our Calgary campus. It's a joint offering from the Dillon School of Business and the Faculty of Health Sciences, and we have an intake every year. It's a cohort model, which means you come in with the same group of people, you do courses with the same group of people, so you get to know one another and build up a network and a sense of community. It's part-time and it's course-based. Because we are interested in people who are working full-time, the delivery mode is a combination of distance delivery and face-to-face sessions. So you won't be in Calgary every week, you'll be in Calgary approximately 3 to 4 times a term, and the face-to-face sessions will be on Fridays and Saturdays. So if you're working, come the weekend for those 3 or 4 times a term that you have face-to-face work, you'll go to Calgary just for those times. The rest of the time you'll be working online with your cohort and the instructor. The goal of the program is to provide management skills and knowledge for either healthcare practitioners who'd like to get into management, or if you're already in management, skills to help you move higher up in the organization. We have 2 alternatives for health services management. You can do a master's degree, which will require doing 11 core courses over 5 terms, which will be followed by an integrated project, which you'll do in your 6th term. We have job shadowing or some other type of experiential learning every term, so you get a chance to learn more and practice about what you're learning in the classroom. And it's designed for completion in 24 months. Alternatively, you can do a graduate certificate, which is 6 core courses, and those are a subset of what you would take in the master's. You do not do a project and you don't do any job shadowing, and that's intended for completion in 20 months. So what are some distinctive features of this program? Well, as I already said, it's designed for working professionals. You don't have to give up your job to work on your degree. It's part-time, it's partially online, and as I've already said, it's just face-to-face some weekends. The rest of the time it is online, so you can keep working. So it's earn while you learn. You can transition from the graduate certificate into the master's program. So if you want to start with the graduate certificate, get that certificate, and then decide that you'd like to do the master's, as long as you do it within a few years of completing the certificate, you can transfer the courses you did in the certificate into the master's and just do the remaining courses and the project at the end to get your master's degree. We are interested both in folks who are health professionals who are entering management, but also you might potentially be a manager who's interested in getting into healthcare, and this program will help you too. As I've already mentioned, we have experiential learning either through job shadowing or other experiential opportunities, and the culminating project at the end is also intended to give you a chance to take what you've learned and apply it in a workplace or experiential setting. And we have small classes. You're not going to be one of 200 students. You're going to be one of a small group of students, again, getting to know one another through the cohort that you are admitted with and that you take all your classes with. We do need to note for international students that because this is a part-time program, graduates will not be able to apply for a postgraduate work permit after completing the program. If you are interested in this program, please contact the International Center at the address given here before you apply. So the courses are structured 3 to 4 face-to-face sessions each term for the courses. And the courses, the face-to-face sessions, since we have 2 courses each term, are on the same weekend. So you would travel to Calgary, or if you're in Calgary, travel to campus just 3 or 4 times each term. Classes are Fridays 4 to 9 and Saturdays 10 to 3 on those face-to-face session days. Again, the remainder of the classes are online. You can do them at flexible times each week that work with your work schedule. For the fall 2020 term, the face-to-face sessions are the weekends as shown here. Note that on September 11th, we will be starting somewhat earlier, probably around noon, to allow for orientation to the program and to give everybody the chance to know one another and meet all of their instructors for the program. What courses will you take? Well, we've given you a list here. The items that are highlighted are just courses you take. You take only those courses in the Masters. So if you look at the full list, you take all the white and yellow courses if you're in the Masters. If you're doing the graduate certificate, you only do the courses that are in white. So as you can see, you do organizational design, health services design, accounting, finance, leading people and teams, which gets into human resources management, marketing, which is here social marketing. How, for example, would you design an effective campaign to encourage people to stop smoking or to do more hand washing? We have a course on strategy, power, and politics, so you better understand the political and policy setting of healthcare in Canada. Art of negotiating and conflict management, including negotiating in more of a unionized environment, which is common in healthcare. We look at health systems in a global perspective and had to help understand how the Canadian system works relative to other alternatives elsewhere in the world. We look at change management, which is crucial in healthcare and something that's routinely done. A course on quality management, both how to measure quality, how to improve quality, and how to basically work on overall continuous quality improvement in the health system. And then finally, for the master's program, the Integrated Experience Project is the project I'd mentioned. It's a capstone project where you take everything you've learned and use it to address a potential issue or challenge in healthcare and explain how to make the issue or opportunity better. Our instructors, we have a great mix of individuals from both health sciences and Dillon who have strong research and teaching expertise. We also have a number of instructors who are healthcare managers and administrators with many years of education and experience. And we think between the two, we can give you a really good quality learning experience. I've included the photos here of all of our instructors, or nearly all of our instructors, so you get a sense of what people look like. And again, in orientation, you should get a chance to meet most of them in September. So what kinds of skills and knowledge will you acquire in the program? Well, here's just a range or a subset of some of the things you would learn. So for example, how do you design an effective service to improve client satisfaction and quality of care? How do you manage conflict? How do you engage in effective negotiations? How do you manage change for a group or for an organization? How do you prepare and use a budget effectively? How do you make lease or buy decisions for fixed assets such as equipment or even buildings? How do you apply design thinking to organizations and problems to be more creative in addressing problems and learning how to take advantage of new opportunities? I've already mentioned social marketing. How do you design a good campaign to encourage people to engage in healthy behaviors? How do you create a job description? How do you manage people? How do you lead a team? The this is sort of a more holistic goal, learning how to apply everything you've learned to a problem in healthcare to improve a particular situation. And last but not least, how do you improve the quality of healthcare delivery? What kinds of opportunities do you have when you're done? Well, there's a range of entry and middle level manager positions. Our program is not intended just to prepare you for the public sector. We also hope to prepare you for healthcare positions in more of the private sector. So there's all sorts of opportunities in hospitals, whether it's in the units or in programs, in the public health offices, in physician and dentist clinics, physiotherapy clinics, public and private sector health services in general, you'd be well prepared for. And the skills you acquire actually are also largely transferable to nearly any other management setting. So if your career path takes you outside of healthcare, you would still have a great range of skills to be an effective manager in a whole variety of other industries. For those of you not familiar with the University of Lethbridge in Calgary, the university as a whole was established in 1967. We just had our 50th anniversary a few years ago. We have about 8,500 students, and we have 150 undergraduate and more than 70 graduate level programs. We've been in Calgary quite a while, since 1996, and we're located right downtown. If you know where City Hall is in downtown Calgary, we're just next to the City Hall C-train station. And if you need accommodations while you're in Calgary for the face-to-face sessions, there's a number of hotels within walking distance, within a few blocks. So it's easy enough to arrange for accommodation, or many folks do stay with friends when they're in Calgary. How do you apply to the program? So our deadline this year is June 15th, 2020, obviously this year. And we've given you here the web address for where you would go to apply. What you need to apply is a letter of intent, maximum 500 words, indicating why you want to apply, what's your nature of interest in the program, and what do you plan to do when you're done. You need to provide a curriculum vitae, a resume, giving us a sense of your academic background, what degrees you've completed, your work experience, any awards you've received, any scholarships and publications you've received. 3 references, ideally 1 from an instructor at the university level, and 2 references from employers, preferably in a supervisory capacity. At the time you apply, you can provide unofficial academic transcripts, and if needed, evidence of English language proficiency. Overall admission requirements, you need to have a bachelor's degree. It should be in nursing, health sciences, or management, or something in a closely related discipline. You should have a minimum GPA of 3 on a 4-point scale on your last 20 university level semester courses. We would normally expect some experience in the healthcare sector. You know, again, a few years would be typical, with a cohort for this past year had experience ranging between 2 to 3 years to 20 years of experience. And again, evidence of English language proficiency if you are not a native English speaker. If you graduated from the university's Bachelor of Management, Bachelor of Health Sciences combined degree admission route, then we waive the experience requirement. So you still need to have a GPA of 3.0, but there's no specific experience requirement. Estimated fees to help in your budgeting. We've given you the fees on a term basis. So if you were in the master's program, for example, in fall 2020, the estimated fees would be $2,666. If you were in the graduate certificate, because you're doing fewer courses, the estimated fees just for tuition and program would be $1,333. If you look at the last column, that gives you the total for the term. So for fall 2020, total fees for the term would be about $2,804 for the master's and $1,426 for the graduate certificate. And if you go down this last column, you can see the fees stay roughly at that level for the program. However, we do need to note that the Board of Governors of the university reserves the right to change fees and deposits as deemed necessary without prior notice, and we've given you a link here so you can look at more fee details. But for budgeting purposes, this gives you a sense of what you'd want to budget every term for fees. You would also want to provide some money for textbooks, and if you needed accommodation in Calgary, and of course travel down to Calgary if you don't live in the Calgary area. Again, just for the face-to-face sessions. For international students, fees are, again, for the fall term in total for the master's, $6,440 and about $3,263 if you're doing the graduate certificate. So again, you can look at the list here and get a sense for every term what the fees are. Whether you're doing the master's or the graduate certificate. Again, we note that the Board of Governors does reserve the right to change fees and deposits as deemed necessary without prior notice. But this again would be helpful for you for purposes of budgeting. So that was a fairly quick walkthrough of the features of the program. Thanks very much, Michaela. We're going to throw it open now to questions. I believe I've already seen one question here provided for somebody who's graduated with a management degree. If your GPA doesn't meet 3.0, if it's very close to that and you think you have some relevant experience, you can certainly apply and we will address it on a case-by-case basis. So again, if you're fairly close to 3 but a little below that and you do have some relevant experience, you can apply and we will consider your application. I hope that answers that question. Michaela, can I throw it over to you to look at other questions? Are there other ones?
Yeah, and thank you for that answer. We've got that question a few times. And do remember that the GPA calculation is done on your last 20 university level courses. So your cumulative GPA may not be 3.0, but if your GPA on your last 20 courses is 3.0, then you would meet that requirement.
Right.
We
Yep,
also have another question about job prospects after the program. So I know you spoke a little bit, Carla, to the kind of general places where you might be able to apply this. It was really interesting to hear that this information can apply to non-healthcare management roles as well. Can you say a little bit more about other places that people might be coming from to do this program, or where they might go afterwards?
In terms of where people might be coming from, we've had a whole range of people who've applied, a number working, as you would expect, in hospitals, people working in public health, people working in allied professions, mental health capacities, things related to addictions counseling, perhaps psychology. All of those would be potential areas. I don't, right off the top of my head, have specific job numbers for demand in the health industry, but I can say that it's certainly a very large industry in Canada and in other countries. And my understanding is demand in healthcare for jobs is fairly high. I don't have numbers though off the top of my head, and I would certainly encourage folks to go and look at some of the more authoritative sources like Statistics Canada, or in your own countries what the demand is for healthcare managers. And I think that would be helpful in gauging overall possibilities when you graduate from the program.
Great, thank you. That was really helpful. We have a question about the blended learning, the way that that works. So could you speak a little bit more to the distinction between online learning and blended, and how the face-to-face component works with the online delivery?
Sure, absolutely. So blended learning means, in this case, because it can mean quite a few things, but for us it means that you do have a face-to-face component as well as an online component. So as I mentioned, 3 to 4 times a term, everybody gets together face-to-face in the same location and works on whatever is assigned for the course for that particular weekend. So it's a great opportunity to interact very closely with your colleagues. I know the students have built up this past year a really strong sense of community with themselves and with the instructors. So that's a few times a term. So that is physically everybody gets together. But for the remainder of the term, We have a web page for every course. Each instructor creates materials for the courses, and you work through the materials. And again, it's intended to be flexible, so you can work on them at various points during the week. There's still deadlines, but it's not like you have to be online at 4 o'clock on a particular day. You can work on things over the week as you have time. And there's still quite a bit of interaction even when you're working on the online components. Many of the course web pages, for example, have discussion forums as a chance for people to discuss concepts together, comment on each other's ideas, and there's certainly group projects where people are interacting. And in today's world, we've got all sorts of awesome online tools, so there's lots of ways for people to interact and work together, even when you're not meeting face to face. I hope that answers the question.
I think so. Yeah, that was great. It sounds like a really wonderful way to balance those two. Our last question is a little bit of confusion about the program length. So could you speak to how long it is expected to take to complete each program, and how long in practice it might take somebody, if it's always the same length of time, or if you could complete it a little bit quicker depending on your situation?
Sure. The program is quite structured. You do the equivalent of what we would call 6 credit hours each term. Most terms that means it's 2 courses. There's one term where you do 2 effectively half courses and 1 additional course, but it works out to be the equivalent again of 6 credit hours. Um, it fundamentally, it's going to take you 6 terms. So we have an intake for the fall. So you take courses in the fall. You take courses all of the following year. Courses again the spring of the year after that. So now we're up to basically a year and a half. And then after you've completed your coursework, you work on the um, experiential point project, and that's normally in the summer of your last year. So overall, that adds up in my mind to 6 terms. You can certainly start your point project earlier than that, than waiting and leaving everything to the last term, and we would encourage that. But you really can't complete it before the last term. So I wouldn't say you can complete the program earlier than 24 months. We do have provisions if somebody, for example, has illness or a family emergency where you may need an extension to the program, and you can take a little longer to do it if something like that happens. But normally, again, it's a cohort program. Everybody goes through it together, takes the same courses together, and for the master's, you would be done in 24 months. For the graduate certificate, you would be done a little sooner because you're not doing that integrated project at the end, so you would normally be done in about 20 months.
Great, sounds good. Thank you. We did get one more question. The program does not have an internship. So how would a student gain work experience for students that don't have any managerial experience currently?
That's correct. It does not have an internship. We do give you opportunities, as I said, for job shadowing, to go and visit with managers in healthcare and see what they're doing and ask them questions. A number of the instructors have added other experiential opportunities, going out to sites and, for example, looking at how services work in that site and redesigning a service. The option at the very end does give you a chance to take what you're learning and put it into a workplace setting if you have one, but it would be fair to say we do not have an internship option by itself. That's not something that's currently a feature of the program.
Okay, that answers that question as well. It doesn't look like we have any more in our queue. Does anybody else have any questions that we haven't addressed, or anything you'd like a little bit more information about? I'll give everyone a moment or two. Okay, well, that brings us to the end of our webinar. So thank you again, everyone, for joining us live. I hope that most of you can join us in the fall or in another term in the future. Again, please don't hesitate to reach out to us at the email on the screen there, or go visit the website, and there's lots of helpful information there as well.
Absolutely. Yeah, Michaela, there's really good information on the website that's listed there, the gouleth.ca/HSM. Or yes, please do email us and we'd be happy to answer any questions that occur to you after the webinar.
Great. Okay. Well, thank you very much, Carla. Thank you, everyone. Take care and stay well.
Thanks, everyone.